Pharyngitis is basically the medical term for a sore throat. It involves inflammation of the area of the throat that we call the pharynx, which is the posterior part of our throat. Most commonly with pharyngitis, most people will think of strep. However, strep actually is not the most common cause of a sore throat. More commonly, viral infections are actually the cause of sore throat. So you can get a viral infection like a cold, and it'll attack our throat directly and cause a sore throat. It can be red, it can even have pus pockets on the back of the throat, and people can think that they have strep and they may not. So really, to diagnose strep itself for pharyngitis, then you need to either do a rapid strep test, which doctors do, or do throat cultures to show that there's actually strep. Other than that, you can't really make the diagnosis of strep by looking. Anytime that a child has a fever and a sore throat, then they really need to be evaluated by a doctor. And at that point, the doctor will probably do a rapid strep test to determine if it's strep or not. And if it is strep, they'll put you on an antibiotic, most likely amoxicillin or penicillin if you're not allergic to it. That's still the drug of choice for strep infections and will eradicate it in most cases. Now, if the strep comes out negative, it's really a pretty good test. It does not miss very often. Only about 3 to 5% of the time do rapid strep tests, if you get a good sample in a doctor's office, do you get a false negative to where you actually have strep and the test came out negative. So the test is pretty good. So if it's negative, frequently what doctors will do is just treat the child supportively, and that means treating their fever and their pain. Sometimes you can use throat lozenges or some sprays or gargles to help alleviate pain in the throat. You can also certainly treat fever with Tylenol and ibuprofen, as well as that treats the pain. And then supportive measures with plenty of fluids and just rest, not having them out running around outside when they have a sore throat. And most people recover from sore throats within about 5 to 7 days. And sometimes even shorter with antibiotic therapy. Actually, strep and other pharyngitis, including the viruses, are very contagious, and people are very susceptible to getting them from other people, and that is the primary source. Now, it's not something that really travels through the air like influenza virus does, so somebody being in the same room with somebody with strep is not the problem, it's touch. And it's not necessarily mouth-to-mouth touch, though that certainly can be a problem. It can be hand touch. So somebody who's sick with a sore throat touches their mouth for whatever reason, and then you shake their hand, and then you touch your mouth, and now you're sick. And or even touching of surfaces. We know that the bacteria and viruses can live for short periods of time on a surface. So if somebody who's sick touches their mouth, then they touch a surface that you'd come around right behind them and touch, and then you touch your face, and now you're sick. The old adages are true about, you don't drink after people, you don't eat after people, because they can actually pass the bacteria or the virus on to you even before they have symptoms. So you're putting yourself at risk by doing those activities. And one of the most important things to prevent disease in general, including pharyngitis, whether it be strep or the viral form, is to wash your hands. So if you can really learn to not touch your face without washing your hands first, you'll greatly decrease your chances of catching pharyngitis, whether it's strep viruses or other types.